and policy, I can't think of a better time for us to be having this conversation. So without further ado, I would like each of our panelists to give a brief introduction of themselves and what they're up to, so that everyone that's listening and tuning in can get a context of all the expertise that we have on the panel. So I will start with Chanel. Feel free to go ahead and introduce yourself.
Hey, peace, everyone. Greetings, my name is Chanel Porchia-Albert. I'm the founder and executive director of Ancient Song Doula Services. We're located in Brooklyn, New York, and we serve all of NYC and Northern New Jersey, and we are a internationally certifying full spectrum doula organization. Currently right now, what I'm up to, we're promoting our Listen to Me Now campaign, which is centered around uplifting the voices of patients, providers, and community members in the event of birth trauma and or maternal demise. And so really wanting to center the conversation on creating accountability measures for folks to be able to tap in and tune in, and hopefully it'll lead to federal legislative policy that will continue on.
Fantastic. Thank you so much. And let's move on next to Cynthia.
Hi, good afternoon, everyone. My name is Cynthia Gutierrez. My pronouns are she, her, and ella. I'm currently in the Alumni land of Oakland, California. Very grateful to be on this panel with folks that I really admire and look up to in this work. I am a first-generation Nicaragüense Salvadorian woman based in Oakland, works in San Francisco. I'm the current program manager for UCSF, Team Lily and Hive, in which we provide services to pregnant people who are experiencing extreme barriers to care. I'm also a doula, a cultural strategist, a storyteller, and just really excited to be here today.
Thank you so much. And I appreciate that you're representing the West Coast, because I'm originally from Seattle, so, West Coast in the building. So last but not least, I would like Sasha to introduce herself.
Hi, everyone. My name is Aleksandra George Ruiz. You can also refer to me as Sasha. I use she, her, and ella pronouns. Right now, I live in Boston, Massachusetts, lands of the Massachusetts people. But I'm originally from the South Bronx, and that's where I was born and raised. I'm first generation Dominican and Puerto Rican, or as I prefer to say, my parents are from Quisqueya and Borinque lands of the Taino people. And currently I work for a federal government agency called the EPA. I'm an environmental litigator and enforcement counsel there. And I've previously worked at Earth Justice, which is a large environmental nonprofit. I was doing similar work, but suing EPA at the time as an environmental litigator. And then I was also involved with Black Millennials for Flint, and I'm still part of the BM4F family. I was a part of the inaugural cohort of Black-led ambassadors a few years ago. Glad to be here.
Thank you so much. And I just realized I didn't say anything about myself. So I'll just give a quick blurb about me. So once again, I'm Vanessa. I come from, on my dad's side, Jamaicans from Brooklyn, and my mom's side, Black folks from Memphis. And I'm proud of both sides of myself. I am a maternal health epidemiologist and a data scientist. I currently work for the federal government. I'm also a doctoral student and MBA student, and I believe in all things having to do with dismantling systems of oppression that have to do with mommies, babies, and communities of color, and the intersections of all of those. So Sasha actually doesn't know this, but I became a part of Black Millennials for Flint because of a panel that I attended that she was on during the Congressional Black Caucus surrounding the water crisis in Puerto Rico. And I was very interested in finding out more about, the Afro-Caribbean community in Puerto Rico, because I personally at that time didn't know much. And she came through with facts and policy, and it was so inspirational that 2 years later, I kept following, and 2 years later, I became a part of the Black Millennials for Flint team. So if you have any questions for me, check me out on LinkedIn. So without any further ado, ladies, let's get started with our first question. So in a recent article in the New York Times, which was entitled "Climate Change Tied to Pregnancy Risks Affecting Black Mothers the Most," it was stated that pregnant women exposed to high temperatures or air pollution are more likely to have children who are premature, underweight, or stillborn, and that Black mothers specifically and Black babies are harmed at much higher rates than the general population. So in your work, how do you see this statistic and similar staggering statistics at play, this interaction between environmental injustices and communities of color? Who would like to tackle this question first?
I guess I'll go first. And I forgot to give my pronouns. It's she, her, hers, or mama or iya. And I'm of the African ancestry, but also the Ramapo Lenape Nation. And I am on Lenape land right now. So some of the ways in which we see it manifest itself here is in, high rates of asthma, eczema, seeing children who have bronchitis, having to deal with environments where we're in an urban environment, so we're close together, people are on top of each other. They find themselves, so a lot of the things that, we have to guide people through are, what does it mean to access services in terms of, postnatally, right? And so postnatally, how do I support my child through not mild cases of eczema, but severe cases of like eczema to the point where like I've seen children's hair falling out, skin is severely like peeling and may look malformed because of the eczema. Parents trying to seek care, but not able to access, care that, maybe is covered by Medicaid. Because maybe you have to see like a private dermatologist to be able to, solve the problem. Also like, trying to solve the problem through holistic modalities, but not necessarily having access to those modalities. So, it's one thing to tell somebody to eat properly, but then if you live in a food apartheid area, then that's not necessarily something that you have access to. And so we, these are consistent problems with, either breathing problems with the parent and or the child, and then an increase in like allergies, asthma, and eczema that continues to perpetuate itself on a consistent basis.
I'm so glad you said food apartheid. We talk about deserts, we talk about swamps, but let's talk about what it really is. Thank you for those remarks. In your other communities, does anyone want to share?
Yeah, I can jump in and share. I think it's important when we talk about these different air pollutions and different environmental factors, particularly in San Francisco, we have to connect it to gentrification and we have to connect it to health disparities. San Francisco has the highest income inequality in California, with the wealthiest 5% of households in San Francisco earn 16 times more than the poorest 20% of households. What we're also seeing is that these impacts not only happen during pregnancy and birth, but are happening with symptoms after, like asthma and other respiratory and skin infections as well. One thing that I do want to share with you all is the work that I do. So it gives you a context of like who we're serving and how it connects to these environmental injustices. And so one of the teams that I work on is called Hive, and we provide preconception and prenatal care to women and couples affected by HIV. And then the other team I work on is Team Lily, and we support pregnant people experiencing barriers to care such as homelessness, substance use disorder, incarceration, intimate partner violence, and or mental illness. And, as gentrification increases, homelessness is one of the biggest barriers that we're learning about. And for Team Lily, in terms of our patients, we're seeing that in terms of the folks that we've chatted with and been able to have their consent in documenting what's been going on with them, 95% of them have stated that they've experienced homelessness. And homelessness in terms of living in tents, living in or existing, quite frankly, in public spaces. There's different kind of shelters in San Francisco, and so each person would describe their experiences with homelessness different. But I say that because if you are living or existing out in the streets, you are being exposed to the toxins of the air, the toxins of a lot of construction that we have going on. For those of you who aren't familiar, we have so much construction due to the tech boom in San Francisco and Silicon Valley. And that consists a lot of in downtown San Francisco. And so, and everywhere in San Francisco. But as you're seeing these buildings being built up and folks just trying to survive, particularly folks that are pregnant, they are being exposed to all those chemicals and toxins that are a direct result of gentrification.
I'm so glad you mentioned that because, you know, when you think of communities growing or, you know, things like that, you don't, sometimes folks don't take into account those type of consequences. And I'm also glad that you defined homelessness in, you know, more of a broad sense, because I think folks automatically think homelessness is a permanent thing versus something you can experience, you know, seasonally. And sometimes housing insecurity is a terminology that we also use. Sasha, did you want to add remarks to this or also anything about your personal experience with this issue?
Yeah, I just wanted to just quickly say, and we're going to see a lot more housing insecurity because of COVID-19.
COVID, exactly.
That is 2020 for the rest of this year and going into 2021. So yeah, I just wanted to also mention that Chanel, you mentioning eczema, I really appreciate that. I have lived with severe eczema my whole life. I'm from the South Bronx, this area called Hunts Point. I don't know if you know it, but historically, when I was growing up as a kid in the 80s and 90s, most of us Black and brown children had a combination of severe asthma or eczema, and a lot of it was due to air pollution and many other kinds of pollution, mostly air pollution. It got so bad at one point that aside from being one of the poorest districts in the entire country, we were also one of the districts with the highest asthma rates in Black children. So anyways, I appreciate you mentioning that because it's very real. And it doesn't go away just because I've acquired different levels of privilege. It's kind of like this kind of, it's a form of environmental racism that's going to stay with me for the rest of my life. And I will likely pass along, if I decide to have children, to future generations. And yeah, I am not speaking on behalf of EPA. I am off work hours, so just wanted to put that out there. Anything I say in this conversation is not on behalf of the US government. I think that in my work currently, there is a lack of focus and emphasis on the health inequity and environmental racism surrounding how Black and brown folks are impacted, specifically Black and brown femmes, women, and non-binary folks, especially folks who are pregnant or could get pregnant or trying to become pregnant and can't. So it's just interesting because I enforce, so I have cases that I enforce under the Clean Air Act. I have Civil Rights Act cases that I counsel on. I have a lot of RCRA, so hazardous waste related cases, and also TSCA, which is a Toxic Substances Control Act case. And you would think that in the realm of those laws, this would come up frequently, but unfortunately it doesn't in my day-to-day at all. I work very closely with the environmental justice coordinator in my region, and he's like a man that's local to the Boston area, Black man, very much continuously trying to center Black and Indigenous communities in New England. And even with being on that task force, it's very rarely that these issues come up, or even when I bring them up, they're centered appropriately. So, and that's a big contrast from my last job where at Earth Justice, similar to some other NGOs, which are full of many, many problems, and I see as racist in and of themselves, but in a lot of those spaces, the litigation brought against entities like EPA and other federal agencies very much try and bring in some of this and try and center on maternal health. It's just interesting to see that not a lot of that like gets into the day-to-day that I have now.
I'm glad that you mentioned that because it transitions directly into the next question, like this policy aspect. So just a couple of weeks ago, the House Select Committee on the Climate Crisis recently released one of the most robust climate action reports in US history, and it's called Solving the Climate Crisis. One of the aspects of this report speaks on strengthening public health capabilities and infrastructure for climate resilience. That's the language that they use. And that is supposed to challenge Congress to do what they're supposed to be doing, which is strengthening national planning to address climate risks to public health and supporting climate planning by state, local, territorial, and tribal health. I know that was a long question, but in your work, how do you, and in our work, how should we ensure that Black and Latina women are included and visible in this plan and other plans around climate change in regards to high quality maternal and reproductive health access?
I'm gonna let my sisters go first.
Yeah, I didn't want to like say, so Sasha, what do you think? Or you know, I don't moderate like that. I let a moment happen, you know, take a breath, think about it, and then whoever wants to speak.
Call me out, Vanessa. But again, I'm not speaking on behalf of US government here. This is Sasha speaking. I think that a lot of the laws, especially environmental and public health and Civil Rights Act laws that we're operating under are problematically centering the people that are centering people who don't need the most amount of attention on these issues. And that's a very roundabout way of saying they're racist. They were made for predominantly white privileged individuals as opposed to the most ostracized individual in our society, which could look like individual that's currently or temporarily homeless, that's also trans, undocumented, Black and or Indigenous, and living with a disability. Like all of those things exist in a portion, like in people's realities, and yet they're not centered. So my initial reaction would be, I would love to see new statute and new regulations drafted by Congress, submitted by Congress, and approved by Congress, which center those folks, written by those folks. And I think that that's saying a lot because, and I'm not an expert in this, so I'll fall back on this point. I haven't witnessed an abundance of organizations that are appropriately funded, led by Black femmes, non-binary women. And I'm purposely using the term Black because I think in the Latinx community, which includes Black and Indigenous people, it's very important to also focus on Black and Indigenous people because there is white privilege in the Latinx community. There's also white passing privilege. So I choose to not even really use that term as a Latina and Latinx woman. I prefer to say we should be centering Black and Indigenous femmes, non-binary women everywhere, including in Latin America and Canada.
Yeah, I think just a veggie back off of that, I think some of the ways that we see, you know, these how these plans are perpetuated is also through redlining and zoning, right? And so, as Cynthia mentioned, when we started talking about gentrification and the ways in which they show up, also how about the intentionality of how zoning efforts have been put in place to, in particular, to segregate, you know, Black and brown birthing people who, you know, within a certain area, right? And so in that context, but also, you know, like us going out into the community and really educating the community about that this is an issue, right? Because a lot of us don't even know that these plans exist, right? So what does it mean for us to like break down a plan for everyone to understand, and then go through what is the processes of bills? How does that even get created? And what does it mean for us to use the community, because community is experts within their care, as to how to address this in an equitable way, right? And then bring those things together as possible plans that can be used to address those things within our communities. Because if our folks, you know, we're so well, because of COVID, we're home a little bit more, and I think that's why we have an opportunity to engage within politics or political reform and policy reform, and a little bit more at a higher rate than we have ever been before, because we can't go outside, right? We can't, you know, some of us no longer have our regular jobs. And so we have a level of engagement that we can now kind of zone in on certain things that we couldn't before. So in that one case is a blessing, but in the next case, you know, as we start to go back to what we want to call as normal can be, people, you know, when you're trying to survive in your survival mode, you don't have the opportunity to engage in a way that is meaningful to you. So I think it's really about the intentionality of these community-based organizations and those who are doing the work to really go out and find ways, creative ways, to be able to engage folks so that they can continue to have a voice even when they can't necessarily be on the front lines to do the work.
And also, like, just to quickly add, can we pay these folks? Like, why is it that
Come on now.
statue and environment? It's not, I mean, like, people organizing and leading need to get paid well. And also the mothers and the children who are on the front lines, like, advocating about their own health, and experts about their own health should be paid well. And also the statutes and regs should explicitly talk about ways for the federal government to give these folks money when they're dealing with medical bills tied to all of these situations, which isn't something I come across almost ever in my work, which is a direct way, even when EPA wins, or even when like a certain nonprofit wins a lawsuit, making sure that those folks get that money so that they can take care of medical bills and other costs.
You know, you all bring up a really good point, because when I saw this question, I made the connection for me. So I work, you know, at our county hospital, but I am affiliated with the university. And so that means that whenever we have to do any sort of like dissemination of like fact sheets or reports, like I'm always questioning, like, who did you have at the table to create this material? And often it is white women who are within the networks of the researchers, the institutions, maybe a white woman they really liked from a conference 2 years ago, and they bring her in and pay that person really well. And one of the biggest critiques that I have is that these materials get created, and then later on, they're like, oh, why don't we get community input? But community and folk were never brought to the table, even from the inception that this project or report or fact sheet was even created. And so that's one of my biggest critiques of like being at a university, and the barriers we have to even getting folks that are Black, Indigenous, people of color, that are queer, that are trans, even just, you know, it's one thing to like invite folks to the table, but if you don't even have the ability to speak up, if you don't have the ability to make decisions at these tables, like what's the point of even having the table? I'm gonna just flip the table over, because a lot of times, like, and I don't know who created this report. I don't know the individuals involved, but like I was seeing some of the fact sheets around, they had like Black farmers, and I thought, like, do you all just like Google these images? Like, do you talk to the people that you have on these images or content? Or those are some of the questions I had when I was just looking through it. And this is me, you know, I work at a university, but it doesn't make me an expert in every topic. But I was like, why is this the first time I'm hearing about it? So I can't imagine folks that are trying to survive a pandemic and trying to survive the killing of like Black bodies in the streets are gonna have the time to sit down and go through this report.
I appreciate. Go ahead.
I was just gonna quickly say there's so much truth there. And just this might be a small tangent, but because you mentioned universities, how like universities, especially here in Massachusetts, like very quickly sued the administration when it was, you know, potentially going to predominantly impact a lot of wealthy immigrant students who, when, in my experience, because I went to law school here at Boston University, most of the people who self-classified as people of color and are Latinx were very wealthy and white or white passing. Very few of us were indigenous and or Black. So I always wonder, I'm like, does a university care? Does a nonprofit care? Like, what's the ultimate goal here? And who's funding these entities? Like, are these Black and indigenous funders? Or is there a alternate agenda here that we're not even really touching?
I think it goes into also like the fact that there's no accountability, right? And so like there's no accountability that's put in place to hold these institutions, you know, for the things that they put out. And, you know, I mean, because we see it all the time. I know we've seen it in New York where they put out these, you know, the Department of Health has put out these ads. And you're like, who did you talk to about this? Like, who told you that this was okay? And then they try to backtrack and you know, try to fix things in the latter and say, oh no, but that's not what we meant. And it's like, but if you know, upheld community as experts within their care from the gate, then you wouldn't have all these issues, you know what I mean? And if you listen, because it's not just a matter of us being at the table either, because there's been plenty of instances where we are there and we'll give all of the recommendations and all of the information. And at the end of the day, that thing goes right out the window and people act like you didn't tell them anything. And they still do what they want to do.
Exactly.
So, yeah.
Vanessa, I don't know if this has been your experience, but it's interesting because in government, there's not supposed to be an alternative agenda. It's supposed to be about the people, all for the people, including the people forgotten. But I end up very frequently flipping tables or having to like walk away from tables in secret because there was such a lack of transparency. And that goes back to accountability with like the community that we're trying to more directly serve.
So I can't speak either as a representative of the government. However, I will respond this way, which is, I have so many things I want to say right now. So as a data scientist, and it goes to what Chanel just said, a lot of times our voices in different spaces, not just in the development of policy, are oftentimes muted by this argument that data does not exist, or what we are saying is not consistent with evidence-based X, Y, and Z. And the reason I say this is consistent with what Chanel said is because qualitative data is data. Lived experience is data. The experts living the experiences that other folks observe and then quantify into statistics and infographics and publish on, that's our lived experience. So this whole concept of, you know, what is this policy based on? Or what experts are invited, as Cynthia said, what experts are invited to develop these policies, to create these reports and fact sheets and things of that nature. I always find it very interesting. And I tend to ask, you know, questions, sometimes I know the answer to, but sometimes asking the question and having the question heard is just as important as the answer. Is I do question, well, what was the person's credentials to discuss the lived experience of someone who has a loved one who passed? Or who created this theory of X, Y, and Z? And why do we use a theory named after someone who oppressed the people that they supposedly were studying, and things of that nature? So it's really important to, when you're at the table, even if they don't call on you, even if they don't give you a chair, even if you don't have the mic, to question everything. And as a taxpayer who funds a lot of these government issues, right? These government efforts, these government programs that are implemented, I have a voice in the way that these things impact my community. And I know a lot of the folks that are listening today definitely understand that, because that's where a lot of our grassroots efforts come from, are challenging what's happening that we observe in our communities. But without going too far down, I did want to just address the idea of, we can't have something about Black and brown communities and I look in the bibliography and I don't see a Black or a brown name. I don't see anyone with a last name that I recognize. I don't see any accent marks. I don't see anything. I see the same people that are cited on everything year after year. And when you Google them, what do they look like? They don't look like the folks that are in their inclusion group in their methods section.
Their diversity group.
Their diversity group. And we're seeing a lot of that now, in response to what Cynthia said with the Black Lives Matter movement really finally being listened to by folks who have been trying to silence them. We're seeing all these diversity and inclusion, positions opening up, or efforts and money going to things, but where's the accountability? Where's the sustainability? What's the turnover? Who's in charge? Is it a woman or a person from many of these communities that have deep intersections in a variety of different oppressed groups? Or is it, someone who's lived a very privileged life who doesn't actually know the experience, and so they can easily say, yes, sure, and push the status quo, right? Okay, I don't want y'all know.
No, but I think it also goes to say too, because when we do come with data, Black and brown folks who are out in the communities who are doing this work, who have, gone through the pathways of collecting data in a meaningful way, and, it's still not held to the same level of validity unless it's co-signed by someone who is white. Right, saying like, oh, or like a white-led organization, like, oh yeah, we back that up. You know what I mean? We give it the okay. So it's like this double-edged sword where you want to have this evidence-based information and provide it, but then still, even with all of your efforts to do that and to make that readily accessible, it's still always second guessed as other or seen as other. Like, oh yeah, that's other, because it's not necessarily that level of validity that they would designate as being top notch.
And how dare we develop an evidence-based program, copyright it, and ask you to pay for it? Then it's a whole nother conversation. Oh, I have to pay for your curriculum? I can't just have a copy of your PowerPoints? No, you cannot have a copy of my intellectual property. This is not only intellectual, but a lot of times it is historical experience that we're just not going to give you to show at a conference just because you want to exploit. Like, no. Okay, yeah, let me get back on track. So I almost want to ask these questions out of order if you guys are okay with that. White supremacy and explicit racism exist in America. We have been talking about this from our variety of different backgrounds, but I specifically want us to talk about in the context of maternal and child health hospitals and physicians' offices. Many of us work in those environments. And in these clinical environments, Black and Latino women range from, have a variety of ranges of accessibility to quality care. That may include differences in language, that may include differences in insurance. But at the end of the day, we know that in doctors' offices and hospitals, Black and Latino women are blatantly ignored, and their concerns are very often not addressed. Even folks like Serena Williams and Beyonce, and folks who everyone knows who that is, everyone knows what their resources are silenced and not listened to in healthcare settings around maternal health. So with that, how has racism impacted the work that you do and for Black and Latino women? And most importantly, how do we work and continue to work to dismantle white supremacy in maternal and reproductive health and justice? I'm looking at you, Chanel.
Okay. So in the work that we do in censoring Black and brown birthing bodies, understanding, the intersections of how people present themselves, you know what I mean? Like a lot of the things that have come up for us is like, one, understanding like if I'm a Black or brown person, I'm supporting someone else who's Black or brown, like, and they like listening to them, what makes me think they're going to be listening to me? But a lot of things that we've seen is, the criminalization at bedside, right? So, babies being put on hold, illegal drug testing, using child protective services as a tool because people know that they're afraid of that and they're afraid of their children being taken away from them as a tool to get them to comply with medical procedures. We've seen partners, have the police called on them, because they refuse like a vitamin K shot or, and it may be based on like a religious reason, you know what I mean? Or the perception of like, when you're working with someone, we work with a lot of folks in the Bronx, some who are like, in methadone clinics, and have other things that are going on in their lives, either housing insecurity, maybe in maternity shelters, who are automatically, these assumptions are being made about them and who they are, with, as Cynthia mentioned, even in the, our populations that we serve are very similar. We serve African immigrants as well as those from the Caribbean at higher rates. And they too are facing situations where they're afraid to go to get prenatal care. They're afraid to go to the hospital because of the fact that, ICE and what can happen to them and all these different things that are perpetuating themselves. And so I think it's really, it's understanding that within the system, there needs to be changes that are not just based on the individual. So one, holding the patient as if like it's your fault that this happened to you, right? Because when we see maternal demise or near misses, is always, well, this person had a chronic health condition, or this person had this going on in their life, or this person, had that, and always placing the blame on the patient and not taking responsibility for the care that was provided to them. Then we have to think about the provider aspect and how they start to internalize trauma and then perpetuate that trauma as it's something normal behavior and continue to do that over and over again. So I myself can come up with a know your rights framework and say, here, this is what you have. But then if the provider has no context for that, it doesn't make any difference. And then you have the overarching hierarchy, which is really the institution, right? And so this is why I continue to say, like, we need institutional accountability and reform that is really like on a national level, because we don't have universal protocols and practices when it comes to reproductive health care. You can be at one hospital that's across the street from another and they're telling you two different things, right? And people are like, but you just told me this, but they're telling me that, right? So you find yourself in this situation where you have to consistently be on top of your research game just to be able to serve someone in a way that's even remotely equitable. And it's not, you know what I mean? And so until we start to address like institutional reform and accountability, all of the other stuff that happens is going to be just one-off, because it's not just the individual provider who's perpetuating it. It's because of the establishment, and there not being any kind of outside mechanism to really say, listen, you can't do that, and to take a license away or take funding away or whatever has to happen so that this doesn't continue to perpetuate itself, because Black and brown birthing bodies deserve better. And it shouldn't take for us to die for someone to be like, oh yeah, that's so sad. Like, I really feel, that's so bad that that's happening to them. You know what I mean? It's like, for real, like people have been talking about this and having these conversations for years, way before I even came into this work, you know what I mean, in 2008. And so we have to start to think like, well, why is this? And it's because we have these piecemeal things that are happening when all of these things need to happen simultaneously, I believe, to really address the issue of Black and brown death or near misses within reproductive health.
To add to that, so to give some context, I've been a birth worker since 2014, and most of the births that I've had the honor of bearing witness and supporting have been with folks who are monolingual Spanish speakers. And I give that context because even in San Francisco, a city that proclaims itself as diverse and inclusive, I've seen some of the most horrific treatments towards birthing people in our hospitals. It's disgraceful, and there needs to be a system-wide change. One person in particular that I'm thinking of, she just immigrated from El Salvador. She had no family here. She had so many fears of like what it is like to be in a new country, a new city, not knowing how to navigate the healthcare that she was receiving, and to have to tell her provider to slow down and ask for her consent felt like I was like doing the most to them. She was in the hospital for 3 days, and there was never a Latina or Latinx or Indigenous provider there. Every nurse or midwife or anyone that came in contact was white. And so what it meant for her afterwards, telling me that I was the only person that even spoke to her in her native language, and how much that meant to her. The fact that that there is like a language phone where providers or healthcare workers can call. And I heard nurses several times tell me they refuse to use it because it's an inconvenience for them. Or that they can just Google the phrases that they want to say. Or that at some point they took some elementary Spanish classes and they were able to just get by with just saying that. And so I share this with you all because it's if we don't call things for what they are, they're never going to change. And as we think around your second question on how to dismantle white supremacy in maternal reproductive health care, I am a big believer that I can't go, well, yes. So I can go and tell people how they're being racist and there's white supremacy and all day long. But if I don't do that internal work and work on myself and have those conversations in my home around the anti-Blackness that my Central American family has, then I would be a hypocrite. I feel like justice really starts at home, and having those conversations and deconstructing a lot of the transphobic, homophobic, anti-Blackness, all the things that in my immediate family I was taught, all the ableism that I was taught. And so, you know, as I'm doing that internal work, I've been able to connect with other healthcare professionals that identify as Latinx, Latino, Latina, and how do we dismantle anti-Blackness in our work within the city and county San Francisco. I really think like we all need to get together and do that work. We as that community that I'm a part of. I think it's also important to really proclaim that like DEI work groups are not going to dismantle white supremacy. There is this fascination with the university setting that I'm in with creating diversity, equity, and inclusion book clubs, DEI talking circles, where folks really feel like that's going to be their solution and their pathway to liberation. And I've told them, please don't invite me to your book clubs. I've tried creating one before with material that y'all can ingest, and you didn't want it. And so, yeah, I really think folks need to do that work consistently, and not when it's popular or not when it's on social media.
Yeah, it's, you know, to veggie off of Cynthia, it's not a branding opportunity. And I think a lot of folks have used the movement right now to kind of center this kind of, oh, I'm an anti-racist type branding, like you're wearing it across your shirt like a badge of honor. You know what I mean? Where it's like, you know, it's like I don't know if you all listen to Erica Hart, but you know, Erica Hart has Erica Hart is has a podcast, Hood Rats, to head wraps. And they talked about how all of these Black Lives Matters signs are up. And I know I live in a suburban area and they like are on the lawn, and it's like in one breath you want to be like, oh, that's really great, and the next breath you're like is that for real? Because I know like you wasn't talking to me like a couple months ago and didn't even acknowledge my presence as a neighbor, and now you like got a whole sign up that says something. And so like, did my life matter a couple months ago, or it only matter now because it's on your lawn? So it's just, it's this situation where, I always say, I say to folks, you got to center yourself before you can center other people. And until people are willing to, consistently understand that you have to actively work on you, in all forms, as we can, as Cynthia said too, in all forms at all times, to be better human beings. Like, what does it mean for us to be better humans? You know what I mean? And come in contact with one another, because we affect each other, even when we may not necessarily be right in each other's presence, or we might be on the West Coast and the East Coast. Like, the vibration of life it continues to flow. You know what I mean? It continues to perpetuate itself. It continues to, so we need to like figure out ways to be in harmony with that. Otherwise, we're going to continue to see these things that perpetuate themselves over and over and over again. And I feel like sometimes it's, I tell people, listen, I see somebody say energy matters. It's about the vibes. Like, what's up with the vibes? Like, do you have good vibes, or is it trash? You know what I mean? Like, and if somebody doesn't have the vibes, like, you just know, you know what I mean? Like, we know it, we meet people and we're like, oh, no, not so much. And so, like, working on that and being active in what does it mean for me to center those vibes so that I can center other people. Because if you're not willing to do that stuff, and it shouldn't be up to Black and brown people to do that for you either. Like, Cynthia shouldn't have to be sitting there writing no damn book club and stressing herself out about what that looks like, you know what I mean? And, or, Alexandra at the EPA, like, yes, colleagues, like, let's work on what this really, this diversity inclusion, what this supposed to really look like. No, it's supposed to be like, you're supposed to do that. Like, take a seat back, be humble. What does it mean for people to be humble and to show up in a way that says, you know what, I don't understand, but I'm going to be humble enough to say I don't understand and work from a place like that? Because I think people will be more open to wanting to receive a message when they know that you're taking a step back to say, you know what, I don't know, but I have a willingness to learn, right? And whatever that makes me feel, whatever comes up out of that, even the uncomfortableness, I can sit with that and make it work. As opposed to like taking this attitude, like, yeah, I read, I forget white fragility and all that. I don't even know half the damn books because I'm like, this is too much. You know what I mean? But, reading all the books or reading, Dorothy Roberts, I appreciate that, but I would appreciate it more if you would just be humble and just be like, you know what, let me just take a seat and say I don't understand and humble myself a little bit so that people can show you what it could look like, because when you have that opportunity, then folks like Cynthia and Sasha and others have opportunity to do the work in a way that centers the folks that they center themselves and the other people that they work with all the time.
Wow. So I want to say just two general things, one about the vibes and one about the lawsuits. So, all right. So concerning vibes, like, I think that there's a lot. So I am not the colonizer that came into this hemisphere, onto these lands, onto Turtle Island, and brought this ideology that is white supremacy with me. Those were first Spanish and then Portuguese, French, British colonizers that did all of that. And yet it's oftentimes Black and or Indigenous people in the position to have to justify and explain that all of this exists. So I saw this very interesting meme on Instagram the other day about how none of this is going to go away until white supremacy becomes a white person's problem. Like, it's a white people problem. It's not really, it's one that we're at the tail end of, but it is something created by them. And ultimately, like, a lot of that energy needs to be poured out by the people who created this, which goes into, like, I really appreciate, Cynthia, what you were saying about people doing the work. It's something that I really want to do as someone who is cisgender and carries a lot of privilege with my education. I've been very, very disappointed with the lack of work done by the Latinx community, especially here. I'm more familiar in the Eastern Coast. I think that there's a lot of issues that we could go through and we don't have the time related to government, which I consider to be colonial governments across Latin America. But I'm not even going to go there. I'm going to talk about immigrants here in the United States who have, for the most part, some sort of identity crisis, where conveniently, especially folks who are not Black and Indigenous, forget who are their ancestors, and that they were the first to bring white supremacy to this hemisphere. And like this ideology that we're dealing with this in the States, including enslavement, was something brought over and invented by Spanish and Portuguese colonists. It's something that, you know, people don't talk about, but 95% of the individuals who were stolen from the lands of Africa, which include Native folks who are Black from Africa, were brought to Spanish, French, and Portuguese colonies, not British colonies. So when you think about that and the amount of trauma that that involves, and then to see this disconnect between that level of trauma and people claiming that racism don't exist, or claiming that Blackness doesn't exist in their communities, or creating this bifurcation of identity where there's this mestizaje, where people think that all Latinx look one way and that people like me and darker than me don't exist. That isn't just offensive, it's a lie. And it's also, it impacts all of us because, for example, what the Black folks did to liberate all of us in Haiti and Brazil was felt across the whole hemisphere. I've been very disappointed. So I really, really hope that I can feel safer in Latinx spaces, and that people will do that work and be at the forefront of addressing that history and acknowledging that we exist. And then regarding the lawsuits, so I listen to y'all and I'm like, sue, 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 that's my inclination. But the reality is, even in my own family, even in instances where people have the inkling or the awareness to know that a lawsuit is something that should be available in the United States of America, it's not really accessible to the people who need it the most. And especially if, Cynthia, you described this fear, and so did you, Chanel, like the fear that people carry. If you're carrying this fear, if you're undocumented, if you're trans, if you've already been persecuted and antagonized by local and federal prosecutors and enforcement, including cops, you're not going to trust the legal system with good reason, because they put your life in danger. Also, why should you trust that that same entity that's trying to take away so much from you is an entity that you should now go to in order to seek justice? There's a lot of, I'm hearing you guys, and I really appreciate you guys speaking about this, because when I litigate under the Civil Rights Act, there's a lot of frustration, like day to day, on very like barriers to including cases or having cases be relevant because of what judges have said in the past, for the most part. And a lot of like work, not just what I do now, but what I did before my last job in the nonprofit, relates back to what mostly these white men have said in the past 100, 150 years, which includes periods of time where judges, for example, called Puerto Ricans animals. So federal judges, I should be specific. So like, it's really racist and inappropriate for these medical institutions to claim that folks should just resort to suing, or that, you know, file a claim and then we'll go through this EEO process, or we'll go through this process where we'll see if there's discrimination there, when that legal system wasn't really built to make sure that person was captured and didn't fall through the holes. And even when people make it to court, are their medical bills going to get covered? What about their mental health? What if they die in the process, which has happened to a lot of queer people over history?
I'm so grateful for your remarks specifically, because that is a call to action that I want to kind of remark on, which is talking about doing the inner work, talking about what's next. I have to mention that when you are a person of color, specifically a Black person, and you're in any of those positions, if you are a Black judge, if you are a Black physician, if you are a Black police officer, you know, being in a part of an institution that is perpetuating white supremacy based on its structure, you have to do that inner work to say, am I not Black, but am I not white, but perpetuating white supremacy? And what does that look like? Because a lot of times when we are also pointing the fingers at white folks doing us wrong, we also have to turn around and say, was that a Black nurse that said X, Y, and Z? You know, was that a Black judge that did X, Y, and Z or didn't stay? So we also have to do work in our own communities to say, when we have the privilege, as Sasha said, of obtaining certain education or doing certain things that get us into a certain position, how are we using that role? How are we using that position? And that's my call to action for anyone who is in this forum today, is if you are, for instance, a professor and you're going through the plantation politics of tenure, are you calling them out and saying, every time I have a Black student in my office crying, I have a Black student in my office talking to me about the other professors that are treating them some type of way, why are you telling me that that's time away from my research that is a reason why you're not going to give me tenure? But you have a DE&I committee. You know, if you are at a historically Black medical school, shout out to Meharry Medical College, but if you are at a historically Black medical school and you know there's something in your curriculum that is not necessarily productive for our community, because we shouldn't have had to hear about, you know, the quote unquote father of gynecology statue being pulled down. We should have pulled that down a long time ago. We should have had something to say about Henrietta Lacks. But that goes back to fear, right? What do we have to lose? But what do we have to gain, y'all? So anyway, I know we are at 2 minutes to the hour. So I really want to round robin everyone on the panel with your call to action, and of course, how everybody can find you on social media. I want to also say to everyone who is making comments and questions, how grateful I am for the questions and comments. And this was such a rich conversation, important conversation. So we may not have gotten to the questions in the comments, but we are going to develop a document of any questions that we can put in a FAQ style document. We will get that to you. But who would like to go first real briefly about what's going on and where folks can find you, and most importantly, what we can do to be a beacon of continued action, because everybody's doing something just from being here, but of continued action for mothers, for babies, for the environment, and to dismantle white supremacy on a regular basis.
Yeah, so I want to be mindful of time, so I'm going to go really quick. My closing thoughts is everyone has a role in order to improve maternal outcomes for Black, Latina, Latinx folks. We all have a role, whether you're a doula, a midwife, a CPS worker, anyone within the community. We all have to continue uplifting one another, supporting one another. I'm here for having doulas before, during, and after pregnancy. We really need to invest in having their support. And I want to give this last little bit. We need to create more pathways for Black, Indigenous, and people of color midwives to enter educational institutions and to be able to thrive in them.
So I'll you back off of Cynthia and say it's definitely important for us to expand the role of midwifery services, support midwives and freestanding birthing centers and Black and brown birthing people and individuals within the work who are opening up birthing centers and wellness centers so that they can do the work within their communities and offer spaces, safe spaces for folks to be able to access. I would also say that you know, we just launched a Juneteenth Birth Worker Seed Fund in order to provide financial assistance to Black and brown birth workers who are proposing initiatives within their respective communities and or who are in school. And so, you know, we just closed applications, but we'll have a second round coming around hopefully this fall. And so check it out. And then also go to Listen to Me Now online. To, you know, which is a national platform to address maternal mortality and morbidity, as well as severe near misses from an individual, community and provider level.
I'll go very quickly. So one, I think that, like I said before, we need new laws to, in many instances, potentially replace what we have right now that is clearly not meant for us. So to the extent that we see these waves of Black and Indigenous folks, including like femmes, women, non-binary folks, and trans people at the forefront, I would love to see more of that. And second, to the extent that we are still needing to operate perhaps temporarily in the structures that we have now, if anyone is interested, anyone who is considering an engineer, scientist, or legal career or public health career in the environmental realm and talking more about getting involved with the federal government or state government, feel free to reach out. I think it's important to have folks representing at the forefront and making sure we're not each spread thin because there's so much going on.
Thank you all so much. I just want to give a huge thank you to our panelists for not only being here to speak to us and share the work that you've been doing, but for doing the work that you've been doing. I know we're over time, so I just wanted to say, please put your updates, your social media in the box. We are going to send out follow-up to everyone, because like I said, I know we couldn't get to everything in this beautiful hour, but that's why we can always do a part 2. Thank you so much. I really appreciate it. And if there's no final thoughts, we will wrap up. Thank you so much.
Thank you.
Bye, everyone.